My name is Isis Swain, and I'm the co-founder and COO of Greens Health. During COVID, my father was diagnosed with type 2 diabetes. It was the scariest part in our lives, and we learned that many people who had chronic conditions were unlikely to survive. We took my father's diagnosis very seriously and attended every doctor's visit. But there was one visit that stuck out to me. It was with his nutritionist, who told my 65-year-old Black father from a small town in Mississippi to stop eating meat and start eating kale. My father looked at me and my husband like, what the hell is kale? But you have to understand, for the last 10 generations, my family has grown collard and mustard greens on their farm in Mississippi. And those are the greens that they prefer. The one thing I wish the nutritionist would have asked is, what are his food preferences? It was clear that there was a lack of cultural understanding in his care, and the one-size-fits-all advice wasn't just impractical, it was alienating. And this was a wake-up call. The average rural healthcare provider is outnumbered, with the ratio being 5 primary care providers serving 10,000 residents with limited staff. So we partner with rural healthcare providers to extend their care team beyond the in-person clinical visit. Our health coach contacts patients for onboarding with first understanding what that local environment looks like with a social needs assessment, and then we equip patients with cellular devices like blood glucose monitors, blood pressure cuffs that allows nurses to track metrics remotely. Our 12-week program not only educates the patients, but also the families on things like device use, self-management, nutrition therapy, and setting meal routines for better medication adherence. This approach doubled the current standard of medication adherence, and we have a 84% participation in self-management. What's even better is our billing team helps providers bring an additional revenue stream of $600 per patient per month, with only using 1 hour of engagement from their care team.
Thank you, Isis, for that excellent transition. I also want to highlight some key traction points that we've been able to accomplish. We received the NSF SBIR grant to focus and validate our core precision nutrition science. In 2023, we were able to achieve our first 2 letters of support and ignite a pilot program in Birmingham, Alabama, with nonprofit diabetes camps. 2024, we were able to raise $300K from Blue Cross Blue Shield Alabama and Innovate Alabama for our seed rounds. Our business model, we charge providers 60% of their reimbursements, and as well as for Medicare and Medicare Advantage payers, we charge $150 per month per patient plus cost savings. Our go-to-market is starting in the 14 million underserved rural health population and expanding into the 133 million Americans living with chronic conditions. Our differentiation from large companies like Livongo and Amada and Care Harmony is closing gaps with precision nutrition and diabetes educations that's culturally tailored for caregivers and family support and training. Hence, Isis' dad story, which led us to our most recent AI-based digital twin. This will help diverse seniors and their families manage type 2 diabetes. Digital twin is essentially something that simulates real what-if scenarios, such as meals, insulin, activity, in a way that's accessible, very visual, personalized, making complex diabetes care much easier to understand. So here's how the current care model works versus what we're going to do in the future. Currently, the scalability of a nurse or medical assistant is a 1-to-1 or 1-to-10 relationship. With our program, one RN can support hundreds of patients. Care delivery speed. Currently, a slow and reactive patient can wait weeks for feedback from experts like endocrinologists. With our program, we are able to be predictive, proactive, and enable a nurse, health coach, and MA medical assistant to deliver expert level precision using AI-backed insights. Lastly, behavioral feedback. Patient may not know which meal/activity caused a spike in the days/weeks. We give them an instant glucose forecast, showing them what will happen if they eat meal and how potentially they could fix it. We have a three-phase project. Phase one, we will recruit 15 patients. Phase two, we will undertake a complete redesign of culture, literacy, and impact for our program. Phase three is where we get down and do our community-based usability testing with two cohorts. Each cohort will have 7 to 8 members. Goal is to achieve 80% usability and technology acceptance score. Our project will last for 12 months, led by PI Daniel Monte from UMass Chan, leading patient recruitment and community-based usability testing. Keelan Swain will lead the technology innovation. Our why for kicking off this program stems from Isis asked for dad. Just imagine if his health coach had the use of a digital twin. Just imagine if she had the opportunity to use precision nutrition. Fortunate enough, we were able to be precise, personalized, and culturally tailored. He went down from his A1C from 7 to 6.4, lost 10 pounds of transformation, and now sees himself there for his kids every day.